Hi everyone. This is a presentation on my final term paper regarding the pathogen Ebola virus. Um, my name is Stanley Quarte, and I want to use this opportunity to, express my condolences and sympathies to all the bereaved family members of those that lost their life through this terrible, and fatal virus that was on the news wave everywhere around everywhere in the world. Um, so my condolences to all the lives that all lives that were lost. Um, to continue with the discussion, we're going to cover these areas. These are the areas that are going to be covered. I'm going to cover. We're going to go over key characteristics of the virus, the disease that it causes, the symptoms and diagnosis, the host, frequency at risk groups, geographic variations, transmission, treatment, and then we'll go over the references. All right. So to start, um, Ebola virus is actually the pathogen. It's a virus, and it comes from the family of Filoviridae. Um, the disease that the pathogen causes, the Ebola virus pathogen causes, is the Ebola virus disease. In terms of structure, um, or its morphology. It is polymorphic. It is helical in shape. It has any segment, and it possesses an RNA with single strand and various lengths. It has, in terms of its length, it's about 80 to 920 nanometers in length. In terms of how the virus actually enters, its entry is debatable till today. However, it is known to enter through a process known as micropinocytosis. The proteins, what happens is that proteins are translated via the polymerase affecting mRNA. And then one thing that evidences its replication is through RNP. However, RNP is actually uncertain at the molecular level. One another thing that can be noted is that the union of the virus starts when nucleocapsids are aggregated in the nucleus area or the perimeter area of the nucleus, and the aggregates actually move into the plasma membrane and parts of the endosome. Right. As far as what the disease that the pathogen causes, like we said, the pathogen is the Ebola virus. The pathogen is Ebola virus. However, it causes the disease Ebola. And then Ebola is known to have four subtypes, known as the Ebola Sudan, Ebola Zaire, Ebola Cote d'Ivoire, and Ebola Resting. Ebola was initially recorded in 1976 in the DR, the Democratic Republic of Congo. However, the origin of Ebola is still unknown to today, but it is commonly noted that it is actually linked with animals like monkeys or bats. In terms of the symptoms, what happens is that um, when the person gets infected, it's actually apparent between 2 to 21 days. The infected person, experiences fever, fatigue to wet symptoms. Um, the infected person also experiences diarrhea. Sometimes you have diarrhea, you have blood in the diarrhea. That is, bleeding is present in the diarrhea, vomiting due to the impact on the GIT, the gastrointestinal area. As a result, the affected person experiences stomach pain and tiredness. Eventually, the eyes become red. The infected person also experiences rashes that affect the skin, and some little bit of hiccups here and there. As far as the host is concerned, it is also well known that um, the natural reservoirs or, or animals that are susceptible to be the natural reservoir host is the fruit bat in the primate whole in primates. But however, there's still some level of uncertainty to to confirm this. But when a spillover when a spillover occurs, the virus actually moves from the natural reservoir host to humans. And in terms of spillover, there's so many reasons that can lead to that. We know that in terms of that biodiversity plays a very critical role um, in what happens within the ecosystem. So, if, for example, if predators that are supposed to kind of have a bountiful prey, if they get destroyed or impacted as a result of an impact on biodiversity, that can lead to a spillover where these hosts can now be able to come in easily in contact with humans to transmit to transmit it to humans. Um, what happened was that you can realize that at risk groups, groups that are really at risk of getting uh, this virus is people that live in areas of Liberia, Sierra Leone, Mali, Nigeria, Senegal. These were countries that were heavily impacted in Africa, the African region, and subsequently transmission occurred in areas in Europe and in the US, in the United States. Um, in terms of geographical location or areas, specifically, most likely rural areas are highly impacted. But that's not to say that it did not impact urban areas. Um, Another thing that needs to be considered is that in countries like Sierra Leone and Liberia, the districts within the um, Kailahun districts, which are and forest areas within these two countries, Sierra Leone and Liberia respectively, were heavily impacted. This is an attestation to the previous point made that the virus actually impacts the rural areas most of the time. People in healthcare occupations are more susceptible to the virus because they actually are available to trying to treat the disease or try to help infected persons. And the devices that they use, if they're not actually used properly or being sterilized or being kept very well, that can also increase the rate of transmission. Also, people that are heavily at risk are those that have frequent visits to Africa, people that are engaged in animal research, and then cultures that places emphasis on the burial of the dead of dead persons are highly susceptible to this virus and are considered to be risk factors. In terms of transmission, we've already hinted that earlier on our previous slide. We did mention that transmission um, is actually conducted through fruit bat in primates. This is yet still uncertain. Spillovers occurs as in if there's some kind of impact in terms of human fragmentation within the ecosystem to cause a spillover to occur. So there's no bountiful prey for predators. So these natural reservoir hosts can now can cause a spillover for the virus to move from the natural reservoir host to humans. The virus uses body contact via the skin and mucous membrane. The eyes, the nose, and mouth are specific channels or medium of transmission. Body fluids, blood, objects, semen, and fruits that have been contaminated with the virus are ways in which people can actually contact the virus. In terms of fatality, it has a very high fatality, 50% fatality between 20 to 90% in the past. Skin is broken through mucous membranes and different cells. So that's how the virus actually, impacts the infected person. It goes through the skin, especially through the mucous membrane, and different cells like the monocytes becomes impacted. epithelial cells, dendritic cells, fibroblasts, and others also gets broken when the virus is able to impact these areas. In terms of prevention and avoiding this virus, or in terms of controlling it or the management of it, I think it's very very important that that needs to be um, worked on, and that needs to be worked on and controlled. In terms of controlling it, the items mentioned in the mode of transmission of the virus requires persons residing in areas more susceptible to the virus to stay away from them. Precautionary measures could also be in the form of regular washing of hands, uh, and then also trying to stay away from burial ceremonies and funeral rituals in these cultures. In addition, gamma and ultraviolet radiation coupled with room temperature exposures within 20 to 60 degrees Celsius can also be adhered as measures to be taken in terms of considering how to control it, treat it, and cure. Over here, it gives us an overview of a chart. The frequency of cases that occurred in these regions, Guinea, Liberia, and Sierra Leone, when it actually outbroke in 2014 to April 13, 2016. You can see that during the month of between September 2014 to I think somewhere maybe end of 2024, you can see those high spikes in the cases, as you can see, with the highest occurring in November 2014 with 3,500 cases. I mean, if you look at the table here, the table gives you a very good picture of what actually transpired in terms of numbers. If the graph is not actually clear, I want to give special thanks to um, the CDC for providing us with information to be able to, as part of as part of this presentation. That's why we're able to get resources and data to serve as a guide for this presentation. Also, these are the list of references: Alan G. and et al. 2015, placing and evaluating approving interventions within a clinical ethical taxonomy of treatments for Ebola virus disease. Is among many other references that we have listed here. Um, that we use in this presentation. I hope this helped. Um, thank you very much.